We are working to decrease obesity, improve mental health, and prevent suicide in our community.
My husband's been diagnosed with hydroencephalitis. Thank goodness the support groups were here, and now I'm attending the caregivers support group. It's wonderful. I feel like I'm not alone.
My husband has been very ill with heart problems, and it's just so nice to have someplace I can go and be with other men and women that are also caregivers, that we can help each other and have ideas, and to know I'm not the only one. It's just other people don't understand. If they're not caregivers, they don't get it. They don't get the everyday stress that is put on a caregiver. I had no idea that it was going to be this difficult. You think it's a loved one. This is the normal thing to do, husband, wife. You take care of them. And I had no idea it was going to be this stressful. And so that helps being here.
My name is C.R. Smith, and I've got over 15,200 and some miles.
That is one thing about Mile Walkers, is they have created their own community, and they do care for one another and look out for one another and encourage each other, and it's just something that you don't get to see very often, and I feel privileged that I get to be a part of it once a week.
Tom was intelligent and funny and just a joy to be around. He had a heart for service. He helped teachers, he helped me, he helped random people. He just really was a kind soul, and I really miss that about him. We discovered that he enjoyed writing, and he would write these amazing fantasy stories late into the night when he couldn't sleep. And I'd read them and just be amazed that they came from my child. In the couple of months before he died, he found some abandoned kittens, and he got up every couple hours in the middle of the night and during the day to feed those kittens until they were able to eat. I guess what I miss about Tom is the daily interactions. I miss his sense of humor. I miss his warm hugs. I miss his just really pure soul. He was a good-hearted kid, and I do struggle with his absence. I'm honored Kadlec has asked me to be a part of their suicide prevention trainings. I talk about the signs of depression and suicide ideation that we and our friends and family missed in our son. And then I try to take the listeners on a journey through an exercise to help them understand what somebody who's suffering from depression might feel like. I think people who haven't suffered from depression don't really understand how someone can come to the point where they're thinking about taking their own life. And it's important to try to help people learn about that and learn to empathize with it. We have a broad range of people who attend the suicide prevention presentations. Some are professionals in school districts or who work with youth in the afternoons after school. Others are family members or friends who have people they're concerned about and they want to know how to approach them about their concerns, or even how to walk along beside them and support them as they work towards learning to deal with their mental illness.
I attended a 2-part training offered at the Kadlec Healthplex entitled A Mother's Story and Signs of Suicide, and was incredibly moved, inspired, and informed. As a young community member, I was initially worried about attending the presentation because I thought the information would be geared toward mental health professionals, healthcare workers, or counselors. The material covered in this presentation managed to be thought-provoking and have a personal effect on attendees of all ages, professions, and circumstances, something especially valuable. As a young adult who was personally devastated by suicide in the Tri-Cities, I attended the event seeking knowledge about suicide. I left the event with motivation, awareness, and resources pertaining to suicide and mental health. After the evening at the Kadlec Healthplex, I felt as though I had a much deeper understanding of suicide and knew how to handle a situation in which I may interact with someone in crisis. I believe this new knowledge meets a significant need in the Tri-Cities, and this opportunity must be utilized by all of us.
When I do the presentations, I tell the people who are in attendance that you are the warriors for change. You've chosen to take a couple hours out of an evening where you could have done anything else, but you're here learning how to help people that you care about. And so the people who attend these presentations, they can leave and they can impact 1 or 5 or 15 or 50 people by supporting them and loving them for who they are, and walking beside them and helping them get better. I think it's important that everyone attend these kind of trainings because mental illness doesn't discriminate. So we all need to be prepared to know the signs of depression and suicide ideation so we can all have a positive impact in our community.
And jumping around and dancing is like so much fun. I love it.
My favorite thing today is the free dance when we were dancing. They taught us to eat lots of fruits and vegetables, and I like to eat fruits and vegetables.
Exercise.
Nutrition. 5 fruits and vegetables every day.
Kadlec's community health programs focus on prevention and improving the well-being of those who are living with health challenges and chronic disease, as well as those providing care for them. We want to reach many more people next year. You can help. These programs can only continue with your support.